Club 21. Developing people with Down syndrome.
Good day, parents. I'm Dr. Tlaka. I'm a pediatrician working at Netcare Unitas. Quite an honor for me to be doing this for you today. Following some discussions with the staff at Club 21, which is quite a wonderful school. I think your children are blessed to be in such an environment. We decided that perhaps it might be helpful if we empower you with some knowledge, some information regarding the sicknesses of our children. So if I may begin with just highlighting the fact that I think we may all be aware that our children with trisomy 21 or Down syndrome, as we may commonly know the term, they are more susceptible to infection, and I'll explain some of the reasons for that. And not only are they more susceptible to infection, they are children who can actually get severely ill from the infections that they get. So I think it is important for us to just understand certain things surrounding infections where the children are concerned. So firstly, why are they more susceptible to infection? So it's related to some of the differences they have in their immune system, for one, and some differences they have in their body structure. So maybe if we start with the immune system. So it is known that children who have trisomy 21 will have some lower levels of their T cells, and T cells we know are quite important for fighting off infections. The other thing that is quite known is that when it comes to immunoglobulins and mounting a response to an immunoglobulin, to an infection and mounting the immunoglobulins, they tend to not mount as good a response as a child who doesn't have trisomy 21. And that we'll see with, for instance, vaccines, where if you were to assess the response to a vaccine, you might find their antibody levels are not as high as children who don't have trisomy 21. Then when we look at the body structure, there's quite a few things that make them prone to infection. Commonly, we find a lot of the infections have to do with the respiratory system. So first thing is, if we try and move ahead to approach, is generally they are children who are hypotonic. So being hypotonic means their ability to clear infections, clear their saliva and their secretions can be reduced in some of them. And that increases the risk for some of those fluids to get into their lungs and increasing the risk for infections. Additionally, they also are known to have narrower ear passages. So ear infections are also quite something that is a common challenge for them. They have a smaller mid-structure of their face, and that means that they then are more prone to getting infections like a sinusitis. And we also know that when we go lower down, looking at the structure of their lungs, there is a difference in the structure of their lungs that also puts them at an increased risk. Now, one thing that many of you may be aware of is commonly they also may have heart problems, what we call congenital heart lesions. And many of them need operations for these heart problems. So having these heart problems, some of them increase the blood flow to the lungs quite excessively, and that in itself puts you at risk of getting more lung infections. So I think with everything I've described in terms of the anatomical differences, you see that the respiratory system, the chest, the lungs, the nasal passages, that's where we tend to see a lot more infections happening. Other anatomical or body structure related challenges for children with trisomy 21 are that some of them may have reflux as a common problem, and the reflux then, if it is severe, can result in some of that fluid getting into the lungs, and again you're now looking at things like a pneumonia caused by the aspiration of that fluid. So I hope that helps to give some idea of why it is that a child with trisomy 21 will have an increased risk for getting infection. Now, if we think about what it is we can do to actually reduce this risk. There's a few things that are available to us. I think the one thing that is important, whether you have trisomy 21 or not, is a good, healthy, balanced diet. That goes a really long way in helping your body to be strong enough to fight infections. So that's something that we need to focus on as parents in general. Another thing is then with the immunizations. Please ensure that your children get the immunization schedule as it is in the childhood immunization program. But what you can also do is go even further and get them additional vaccines. Case in point is the influenza vaccine. Given that we are actually approaching the winter season and already seeing some influenza virus patients coming through, it would be advisable to actually take your child for an influenza shot, so that should they come across the virus and contract the virus, they don't get very ill. So that's one thing I'd encourage. And some children may have qualified for what we call Synagis. So Synagis is additionally a shot that they get, or vaccine, to help them fight RSV infection. So generally selecting the high-risk patients, those are children who are still waiting for their heart operations, among other things. Children who have diabetes. So there's a list of high-risk children who should be getting Synagis, especially under the age of 1. So that is something to discuss with your healthcare practitioner. If your child is under the age of 1 and has certain high-risk conditions, that they get Synagis doses, so that should they get RSV, that they're able to fight it off and not get severely ill. Then the other thing, I think, if we recall at the beginning of the conversation or the information session, we discussed the fact that they don't really mount a very good response at times to vaccines. Their immunoglobulin response is not as it should be. So the one thing to advise, especially if you see that your child is frequently getting quite sick, needing to be in hospital quite often, is to have them, when they are a bit healthier and have recovered from the illness, have their antibodies to the vaccines checked, and that allows for the healthcare practitioner to then optimize their response by repeating some of the vaccines. So that is something else that we can do to ensure that they don't get severely ill. Another important thing, which extends to the home, extends to shared environments, is the hygiene practices. So that's something that we can ensure we do quite well, is to practice good hygiene so that we're not spreading the illnesses. And another thing is then avoidance. If we know that someone is unwell, either that person should ideally be at home so that the infection doesn't spread. And even you as a parent need to take that decision to say, look, my child is quite ill, let me keep my child at home. But we'll get into some of the things to consider and signs to consider in terms of keeping a child at home when they are quite ill. So we've discussed why it is that trisomy 21 children tend to be at a higher risk for infections, and tend to actually get more severe infections, and it's related to differences in the immune system, differences in their body structure. And we've also discussed some of the things that we can do to ensure that they don't get very ill. And now I think it's fitting to discuss some of the signs that we need to look at that will guide us to know when to maybe consider keeping the child at home, taking the child to a doctor, so that we ensure that we don't have a spread of these infections. So the one thing is, if your child is actually not really themselves, they're quite lethargic, sleeping a lot, not as active as you know them to be. That often is a sign of them being quite well. So we talk about certain soft signs that you as the caregiver, someone who knows the child well, will be able to pick up that today we're not really behaving like we normally do. I'm quite under the weather is the term that's often used. When a child is like that, often it's signaling that they're quite significantly ill and they should probably ideally be at home. The other thing then is the issue of fever. We always say a fever greater than 38 degrees, that's quite a significant fever. And that's ideally then when the child should see a doctor, and ideally when a child should actually stay home. Because when you have a fever that high, that is when you're actually most infectious to other children as well. And the guidelines then also state that you should ideally aim to have a 24-hour period without a fever before you then consider being ready to go back to a common environment like a school. The other things to consider to look out for, vomiting is one sign also. Generally, once there's vomiting, we know a child is significantly ill, and that's often we'll always be taking them to a doctor at that point. So another sign that often indicates that a child is really unwell, and this is a sign that should definitely lead you to taking your child to a doctor and keeping the child at home, is vomiting. So vomiting often underlies a significant illness and needs to be attended, particularly due to also the risk of dehydration. Also linked to vomiting then is diarrhea. So any child who's having a diarrheal illness, this is a child who really needs to be in the home environment, needs to be seen by a healthcare practitioner, because diarrhea is quite infectious, and anyone handling these bodily fluids, vomiting, diarrhea, then runs the risk of contracting the infection themselves. And that is why whenever there's vomiting, whenever there's diarrhea, these are children who should be kept home, so that we can also monitor that their hydration is adequate. And if they're not settling, they're not responding to the treatment provided by the doctor, oftentimes they need to be admitted to ensure that they do not dehydrate. And then another sign is then to discuss the runny nose. So if you can see the link here, anything that's producing bodily fluids outside of the body, that's a runny nose, that's vomiting, that's diarrhea. These are a bit problematic for a child to now be going to school. So with a runny nose, generally we know viral illnesses can give you sort of a clear but really profuse runny nose. The sputum can also be a bit whitish in color. That's typically viral, and you carry a lot of the virus particles in those secretions. So that is also another reason why it's important for you, when you're managing a runny nose, to be washing your hands, and ideally in those early stages of a runny nose, because it can be containing a lot of virus particles, is to have the child managed at home in the home environment and attended to by a doctor. When a runny nose is now turning towards a greenish mucus, yellowish greenish, that tends to indicate then that there's a bacteria that's now come into the picture. And it's very common that you start off with a viral illness and then you contract a bacterial infection that will then require antibiotics at that point. So that is also another point, another indicator that you have a process that is infectious when the mucus is yellowish greenish. And so that is the advice that we give, is that you ensure that they get attended to, that these bodily secretions, they don't come into contact with other healthy people, because that's how the healthy children and teachers and anyone else can get these infections. And please do get the children treated. So this is just some of the signs that are important to consider for ensuring that you keep the child at home, let them recover. Remember, we need at least a 24-hour period when the fever is not there and you haven't needed to give fever medication. And we also need a time where the cough has actually subsided. The cough can linger, yes, but generally then the child should be well, should not be having a fever anymore, and the cough is usually less than what it was. Then we say they are no longer infectious, but that's usually only beyond the 5-day period or so. So they do still then need to be away from people in those first few days where they're infectious. I do hope this has been helpful. We're more than open to providing more information and answering any of your questions that may help you to better understand how to navigate infections with your children who have trisomy 21.
Visit our website for more information or follow us on Facebook and Instagram to stay up to date with the latest happenings.
School? What's your school's name? Club 21.